And yes, we are live at the Autism Renewed Conference 2026. Wow. Autism Renewed Conference 2026. Wow. Good morning, evening, good afternoon, whatever part of the world you're joining me today. Welcome to the Autism Renewed Conference 2026. We've done this for a while now. It's so good to have everyone here. This is day one. Today is day one. And wherever part of the world are joining me, let me just see your comments in the comment section where you're joining me from. Today is day one, and our theme for the conference is beyond diagnosis and labels. Beyond diagnosis and labels. This topic is a very dear topic to me because in working with clients over the years, I tend to see a lot of parents and caregivers, even educators, who tend to place a label or limitation on children. So once you hear a particular diagnosis, just assume that everything a child can or cannot do. That means the things that are doing that seemingly, not good, or the things that they're supposed to be doing that are not able to do. Everything's all tied to the diagnosis. And I've seen children, overcome limitations. Once you take off the lid, you begin to see that a child has far more potential than you can imagine. That's because sometimes a child can they actually have more capacity than they're able to express. So sometimes when you're measuring from the point of expression, that means that your matrix of measurement, you're measuring from a weakness. So all you're going to be seeing are the weaknesses instead of going from strength to weakness. So when you go from strength to weakness, you give a child a chance and you support them beyond your expectations able to thrive. That doesn't mean, of course, that it's going to come easy, but it may not be easy, but it's doable. I see you all from in the comment section from different parts of the world. And I want to say thank you for joining us today, day one of the Autism Renewed Conference 2026. So I'll just come off my slides now and we move. I put on my slides and I will move. Yeah. So today, day one, and like I said, I've just given up a summary beyond diagnosis and labels, and that's to say that giving every child an opportunity and not using a diagnosis as a cap to their potentials or their abilities. All right, let's move. So today is day one, and today it's a 3 days conference, today, tomorrow, and on 25th. So a little bit about me. My name is Dr. Lalke. I'm a trained medical doctor. I'm a certified behavior analyst as well, and I'm a global autism expert. I work with parents of children who have developmental delay and autism, speech delay, different forms of developmental delay. Like, that when it comes to developmental delay, you look at all the different milestones. And I coach and support parents on how with strategies they can use to support their children to navigate these challenges on a day-to-day basis. I'm founder of Autism Renewed, and which is my organization or platform through which I support various families, even educators, on how educators can partner effectively with families for children with developmental delays to thrive. Because the truth is that any form of intervention or therapy that does not involve the parent, the caregivers, we always say caregivers, but most times parents are the caregivers. So the caregivers are the primary people who take care of the child. But most times parents are the caregivers. So when I'm saying parents, I'm actually referring to the caregivers, because in some cases I've seen handled cases where the parents may not be the primary caregivers. Could be the grandparents, could be family members, due to different reasons. Could be due to health reasons, social constraints, even loss and things like that. But most of the time you hear parents. When you're hearing parents, just know we're referring to the primary caregivers, because the primary caregivers are the ones that are with the child, and any intervention you're carrying them along. So just as a side note, so I help them to how they can support these children on a day-to-day basis. And basically I help them to be able to take the therapy room intervention out of the therapy room to everyday life. Because the truth is that no matter how much you do intervention in school, in therapy room, because therapy is not supposed to be isolated and remain in the therapy room. The strategies or anything you're doing for a child, the goal is for you to take it out of the therapy room into everyday life. So, for example, you don't learn language in isolation. You don't learn to regulate your behavior in isolation. You don't learn communication just for the therapy room or for classroom. You learn communication or language to interact in everyday life. When you're home, when you're in the mall, when you're relating with family. So whatever strategies are being taught in a classroom setting, in a therapy center, or even when the therapist comes home for 1 hour, 2 hours, and they go in everyday life, you want to be able to transfer that learning into everyday scenario so that it gives the child the opportunity for practice. And that's the only way mastery takes place. And there's something we call generalization. Generalization means that when you learn something, you can use it in different settings. And until mastery has taken place, a child cannot transfer those skills or learning into different settings. I mean, generalization cannot take place. So if you learn how to communicate in a certain way, until you can communicate in different settings at home, in church, in the mall, your cousin's place, on the playground, then mastery has not really taken place. So that's the goal. So that's why I believe that the parents are like the bridge, that the ones that are that the middle men between the therapists, the professionals, and the child. So they are able to take whatever is being taught or being done, transfer to everyday life because they have their children with them, most of the time. So those times are opportunities of practice to build those skills to navigate. And even if there are challenges, they can give feedback to the therapists or professionals and they help them to troubleshoot again. So in closing that gap, because I find usually there's always a gap between the professionals and the parents, because sometimes professionals are speaking language, medical terms, or things that are just above and beyond. The parents cannot relate. And sometimes as well, parents also struggle to communicate effectively because sometimes, of course, parents can be emotional, which we understand, can be overwhelmed. So sometimes they don't really know how to communicate. They don't really know how to carry the therapist along. They don't really know how to partner effectively with the school, with the professionals. So that's where I come in to teach parents how to become therapy partners, to be able to step up to partner with the professionals and support their children, translate what is being taught in therapy room to everyday life so that mastery can take place and the child can generalize the skills. So, of course, so I support them in different areas: language, behavior management, nutrition, everyday life, even creating a supportive home environment that help children to thrive. Because that I believe in putting the power in the hand of the parent, because an informed and empowered parent becomes a parenting advantage for a child to navigate and thrive. Because at the end of the day, the parent makes most of the decisions, decision of the school, decision of even the professionals most times. Even if you're going to relocate to a country, you're going to harness services. The parents make the decision, or the caregivers. Okay, I want to relocate to this country. I want to move to this city. Most of the time, the parents or the caregivers. So, how knowledgeable they are, how empowered they are, not just knowledge as information, but as a form of empowerment, it helps them to be able to support their children effectively, even on days where there are challenges. Because remember, it's a journey. So, but they'll have, enough what do you call it, support, knowledge, and they're empowered to navigate and help their children to thrive. So today, day one, we're going to be talking about I tagged this seeing clearly, because the goal of today's session is to break limitations, to reframe thinking for parents and caregivers, and to shift from label to insight, and to build awareness about what's truly possible for your child. So you're a parent here, you're an educator here, you're a caregiver here, I want you to shift your mindset, to move from that limitation, from that label, from that ceiling that um that the diagnosis has placed or you have placed. I won't say it's the diagnosis, because at the end of the day, diagnosis is not the issue, it's the perspective or the lens through which you're viewing the diagnosis or the situation. So breaking limitations. So I want to challenge you, I want to challenge you and not to put a ceiling on your children. I want you to reframe your thinking, to shift from the diagnosis driven thinking to a curiosity driven. That means not saying um what do you call it? What is wrong with the child? No, say what is happening to the child. Shift the perspective, because that curiosity perspective helps you to begin to think what's going on. When you begin to think about what's going on, then you're thinking, okay, how can I best support this child? Or what is the child trying to communicate? What's going on? So instead of thinking what is wrong with you, kind of why are you doing this? You understand? You're reframing your thinking, because your perspective, your lens really matters on this journey. And I want you to build awareness to understand the whole child behind the label. So, and for me, it's not the awareness of people just, okay, we're doing April is autism awareness month. We're building awareness, just awareness as a form of, that this exists, that this is happening, that for me, that's not empowering. That, okay, this is happening, this exists. How does that empower you to take steps? Okay, but awareness in terms of this exists, but these are the reasons, or these are the possible reasons, or these are the possible ways to navigate it. And a form of awareness that is empowering, not a form of awareness that is just, okay, I'm informing you and I'm just encouraging you. Oh, this is happening, be encouraged. No, from encouragement to empowerment. Because encouragement, if you are encouraged and you don't have the knowledge, the tools, the strategies, you are not empowered, and you cannot really help. And I'm not just after encouraging you and making you feel good and saying it is well, and no, I'm after being able to empower you. You understand? Because when you just say, okay, keep hope alive, that hope must be resting on something, must be resting on knowledge, must be resting on steps that are being taken in the right direction. That's when you're hoping to see out. So not hope that I'm just hoping. No, hope based on, I'm doing this and I'm hoping and I believe for this outcome. If you're not doing anything, what are you hoping? You're just hoping for magic to happen. So you cannot help a child from the point of diagnosis. I always say this all the time. I think this is my own quote. This is my quote. You cannot help a child from the point of diagnosis. And I will explain what I mean by that. Just meaning that the fact that there's this diagnosis, just that knowledge of that diagnosis, you can't help the child from that point alone. Okay, you need to be able to shift backward and be able to look, okay, this diagnosis, what's going on? Do you understand? Because 3 people can have the same diagnosis, 5 children can have the same diagnosis, but behind what we are dealing with may be different. So sometimes the diagnosis or the manifestations you see is like an outcome. It just describes what is happening, but it may not necessarily give a picture of what is leading to that, or how you can best support the child. So just saying the child is diagnosed with autism, global developmental delay, speech delay. Okay, yes, that's a starting point. Okay, it's a starting point. Then we now begin to drill down, because speech delay is not speech delay. For example, now we have expressive language delay, we have receptive processing issues. In fact, when we talk about even speech delay, in the real sense of it, most of the time, speech delay is not even the right word. But most times we use we use lingua, or words that maybe families or people can relate to, because most of the time when it comes to speech, language, communication, they're actually different, but most of the time people don't know. So what people call speech delay, in fact, is actually a language delay, because speech is just you voicing when I say the words or the sound. Language is now using your words to interact. So most of the time, what most children have that we're calling speech delay is that, oh, the child is not talking, no conversation. That's not really a speech delay. It's really a language delay. But most times we use words that, of course, people can relate to, because if you start using words that people cannot identify with, you just kind of lose them. So that's what I'm saying. So now imagine that from that point of that diagnosis, that word alone, you can't really just help the child. You have to drill down that, okay, what we are seeing this expression, what is going on in code behind the scenes, what's happening with the child, how can we best support this child? That's the way you can really help a child, to drill down beyond just the diagnosis as the word, as the terminology. That's what I mean, as a terminology. If you say a child has autism, even if you say level 1, level 2, level 6, it doesn't mean the same thing. Their challenges may not be the same thing, and there are different factors that would also impact on how they navigate, how you support them, and even the outcomes you see. Environmental can be there. You can have genetic, you can have family dynamics, you can have different things. You can have ongoing medical conditions. So many things can come and be form of interplay. Also, even in putting interventions in place, how the child learns and the skills they have, all those different things would matter. So you may be trying to teach a particular skill, but the methodology or the way you teach it would also matter. One of my favorite quotes as well is, if a child doesn't learn the way you teach, then you teach the way the child learns. That also applies when you're trying to support a child who has developmental delay, who has speech delay, autism, or any form of developmental challenge. You also have to teach them, support them in the way that aligns with how they would best learn, or that is most effective for them. So the most important shift you will make this conference will begin with understanding why diagnosis alone is never enough and what to do instead. So remember, you cannot help a child just from the point of diagnosis. You have to find out what is going on. So not take away the diagnosis, I mean, like, just put the diagnosis to one side and really be able to drill down, because a diagnosis does not equal this is the solution. This diagnosis, this is the solution. Speech delay, this is it. No, it doesn't work that way, because it could be different things that are going on at the same time. And until you're able to identify what is going on, then you can't really put effective intervention in place. Also, you will not be able to measure progress of your intervention. So let's talk about, like I was talking about, the core problem. So like I said, the same diagnosis, may not be the same for every child, and the solutions will not be the same. Like you have here in my slide that I've been trying to explain. So we may have the same diagnosis, but what we're dealing with may be different. Child A may have severe gut issues that could cause behavioral challenges. So, for example, when it comes to behavioral challenges, a child is showing having behavioral issues, head banging, or throwing what we call tantrum, or sometimes meltdown. It could be due to gut issues. It could be due to the environment. It could be due to primitive reflexes. Primitive reflexes are your childhood reflexes, which are more like a protective reflex that children have. So, for example, your startle reflex. A child, when you make noise like the child, a baby will be startled, and the startle reflex, moral paralysis reflex. But as children grow older, we gain higher skills. So most of those protective reflexes tend to go away. But for some people, it may not go away easily. So if the child still so some children, they tend to get overwhelmed. But the way it will manifest will be different from a baby that you're just clapping and the baby is startled. That child may be easily overwhelmed by noise in the environment, even people raising their voice, music. So, but because you may not know that's what's going on, the child will just be manifesting as behavior issues. Any little thing like this, the child just gets scared or is overwhelmed or things like that. And that's what you're going to be seeing. But unfortunately, the child may not be able to communicate that that's what's going on, because they themselves may not be understanding. Because it has to do with their nervous system. So they cannot interpret that, okay, the child can tell you that my nervous system, I'm overstimulated. They can't communicate that. They just find themselves they're unsettled, or auditory hypersensitivities. For example, some children are hypersensitive to sound. Sounds that you and I may be able to tolerate, they may not be able to tolerate it. So sometimes maybe the humming sound of your fridge, or some people when they are blending something. Some children, that sound, it triggers, it can trigger a behavior. Why? Because it triggers their nervous system, that sympathetic nervous system, which is the fight or flight. For example, you and I, if I see a lion, I will run, I will jump, which is expected. So, but for some children, something that is not as big as seeing a lion, that sudden sound that just pops up, it kind of like, activates that same response in them, and they can just get overwhelmed and scared, and the child starts, having behavior issues. So you may be seeing that. You see all those three things now. Somebody would give it a name and say they have behavior issues, or they're having meltdown, or they're having tantrums, or whatever. But at the root of the core challenge or the core problem is different. So if you're trying to use the same methodology for all of them, it wouldn't work. Or even if you have to use certain methodology or certain strategies, you have to be able to, modify it or customize it, or even understand why it matches to that behavior, so that you are able to measure progress. Yes, some things may be general, all right, but in order to measure progress, you can't just be guessing and say, oh, this is general. And that's why sometimes I find when people are trying to market things, when you see people maybe market supplements, market a product, or market a strategy or something that they're doing, and they want to make it look like that one thing solves everything. And that's not always true. Oh, this supplements, oh, because my child has this, I did this, and that this has come came. So another parent wants to say, because their child is also manifesting something similar, they think they can also take that thing and use it. And sometimes you find out that you're using it, you're not seeing any result. And why is that? And that's what I'm explaining. Because you're only looking at the point of diagnosis. You're only looking at the point of manifestation. So you hear parents say, oh, my child has speech delay. I use this particular supplement. I use folinic acid or something. And boom, child develops language. Or I change the diet, gluten-free, casein-free diet. Boom, language explosion. Another parent does that and nothing. And it's only, oh, what's happening? But my child had the same diagnosis. In fact, the same level 2 or level 1, level 3. The truth is that you are only considering the point of manifestation, the point of diagnosis or symptom. You see, they are manifesting the same, but the challenges are different. That doesn't mean that everyone will benefit. So, for example, if you talk about exercise, talk about diet, having an exercise, eating a healthy diet, we all know that we will all benefit from healthy lifestyle, diet, and exercise. That's a general rule. However, that will not work for different situations. So some people that are dealing with maybe they're overweight and they're having maybe symptoms due to that. If they now reduce their weight, they're going to get a massive improvement. Because what you're dealing with may not be maybe something that is hormonal, may need another intervention. You see, so that's why you can't just take a blanket and say, okay, because this child was diagnosed with speech delay or autism, this supplement was what did this. No, it could be have been that maybe that child had nutritional deficiency. It could be that child had a gut issue, for example. We have the gut-brain axis. So maybe that's what the child has. But your own child may not really have a gut issue, maybe dealing with something like maybe it's a primitive reflex issue. Some children, even in rare cases, have genetic issues. Yes, that is rare, but that could be it. So it may not be the same thing. All right. We'll see more examples as we go on. So the point is this: you can't just stay on the point of manifestation or diagnosis and want to just fix the problem from there. No. And another thing is that if you don't drill down the core problem, you may be seeing improvement because some conditions would improve over time. It might not be like an overnight change. All right. So if you don't get the concept correctly, the child may actually be making improvement, but your matrix of measurement may be wrong, your expectations may be wrong, and you may even be giving up sooner than you should. But if you understand what the core problem is and you're not putting interventions in place, so your matrix of measurement of what progress will look like would be you have the right perspective, and you will not be waiting for the total outcome as proof that what you're doing is working, because sometimes it might be in layers. So the improvement, so for example, the child may not yet have developed full conversational language, but a child that did not have awareness before, was not even aware of his environment, was not initiating, was not having joint attention, was not responding to cues, that child now starts becoming aware of their environment. Joint attention can initiate. When you make a sound, they respond, even though they don't yet have words. You can already begin to see all the pre-verbal skills coming up, you see. So that is improvement, you see. So you will not give an answer, oh, the child doesn't have words yet. That means that whatever I'm doing is not working, not necessarily. All right. So that's where this concept of understanding, not just focusing on the diagnosis or the outcome, but really drilling down to see what's going on with the child. So you can have different labels. So you can have the same label for completely different needs. So one size fits all thinking, is not the right way to approach when your child has a developmental delay or autism. Okay, so let's even talk about how diagnosis is made. Most times, but sometimes diagnosis can even be subjective because we have different methodologies depending on the country or wherever. So most times we do like a checklist based assessment, or even when we do a phone call called a functional assessment, where they interact with the child depending on the age. Sometimes the therapist can watch the child interact, but even in observing the child or interacting with the child or giving the child instructions and things like that, it is still it's still a checklist based, meaning that there's a matrix with which you are measuring or you are assessing the child. And you know that that can be very subjective. So it's, for example, some children, if they're not having a good day, it can be very subjective, may not respond as much. If they're in a different environment they're not familiar with, they may not respond as much. Or because they're not familiar with the person doing the assessment, even though maybe the parents are there, even though it's in their house. But some children, as long as they're meeting you for the first time, some children, it takes them a while. Even some children who are neurotypical, it will take them a while before they adjust to you. So it doesn't mean, so imagine that kind of child now. What you're going to get on that assessment will be very, very subjective. All right. So in that kind of case, so the child meets 4 criteria out of these, then he meets this diagnosis. Another child is meeting 3 criteria of things. So it can be very, very subjective, because I've seen children who they may not even meet all the criteria to be given maybe a diagnosis of autism, but yet they still have challenges in one area or the other. So are you not going to say because the child doesn't have a diagnosis as a label, then we're not going to support the child? Yeah, the child is having challenges reading, child is having challenges learning, understanding. It may not be as profound, but the challenges are there. And the interesting thing is that as the child grows older, some of these gaps will begin to increase. So are you not going to say because the child doesn't have a diagnosis, you're not going to support the child, even if you're not able to access maybe insurance or resources that would have been given to the child if they had a diagnosis? You will still find a way to ensure you give your child intervention. So even if the child doesn't officially meet the matrix of the diagnostic criteria, because I have parents who come to me and the next thing say, "Oh, my child doesn't have a diagnosis." Okay, so I'm like, that's not the issue. What is the challenge? Okay, they did the assessment, you didn't qualify for the diagnosis, but yes, you can still see struggles in different places. So don't focus on the diagnosis. If not, you're putting a label. You are assuming that because they don't have the official diagnosis or they don't meet the criteria for it, then it doesn't mean that they're not going to put intervention, they're still going to support the child. So taking off that cap of the diagnosis or the label, it really helps you to see your child, see the child, and be able to look at the child, their needs, and support them. Okay, so assessment tools also are not perfect and they're not always objective all the time. Okay, so use them, have the idea that okay, they help us to identify patterns, not that they help us to define a child or a child's potential or to map. Okay, they help us to identify they may not map root causes as well, and they may not be able to identify or define a child's potential. Okay, so diagnosis is a starting point, it's not a finish line. That's what I always want parents to understand. It's a starting point. It is not a finish line. So that whether or not your child fits into a diagnostic matrix, the fact that they still have challenges here and there, they still need to be supported. So just have that mindset that diagnosis is not the finish line. It's just a starting point and it points to you in the direction that you need to support the child. Okay, so when you think about a diagnosis driven thinking, what it does is that, so for example, you say, my child cannot read because they have autism. This just stops you from being able to explore possible ways to support the child. And sometimes, just some people just end the conversation. The conversation has even started, has ended before it even begins. And I see this. This is something that I have seen. Rather, why not think in this way? My child struggles with reading. Okay, what are the specific barriers they could be having? For example, even yes, the child may have autism. What are the possible barriers children with autism may experience? And that may vary from child to child. So things like sometimes they will have visual eye tracking issues. They can have auditory processing. They can have hearing issues. Sometimes as well, the way they learn. Some of them are right brain learners. So the methodology of teaching them to read and how you're going to communicate it really matters. Some of them may also have, maybe they have behavioral issues, they have sensory issues, they have hypersensitivity to sound, to light. So the environment has to really be friendly for them for them to be regulated. If you're not regulated, imagine you're in a stadium. Look at how the noise is. And I'm trying to teach you or talk to you. See how overwhelming that place is. For some children, some environments are like that. And that's why some children will do better maybe in a smaller school or a smaller setting compared to a larger place. So you have some schools where the classroom is so large, there's so many children, school, so many things are going on, sound here, jumping here. Some classrooms are so overwhelming in form of decoration. This one here popping here, this one. For some children, that can be very overwhelming. And that might be why they are dysregulated. They are not regulated. They are not calm. They can't be present. And if you cannot be present, you cannot engage with the environment. Child will struggle to learn. So for some children, that could be the issue. You understand? So I want you to shift from a diagnosis driven, to curiosity driven thinking. Like be thinking, okay, what's going on? Let's investigate. What are the areas of what are the barriers? How can we support the child? Are there resources? Are there strategies? Okay. It helps you to begin to think instead of thinking that okay, because of this diagnosis, then this child cannot. Even things like eye tracking issues, there are strategies to support such challenges. All right, doesn't mean that it's going to come easy. Like I said, it might take a lot of support, consistency, frequency, intensity, but at least your matrix is correct and able to measure progress. Okay, so diagnosis becomes a ceiling when you attach everything to the diagnosis. Okay, so for example, when you say because of this diagnosis, child can do this, it makes you stop investigating. So diagnosis becomes the answer to every question. Oh, child is not reading because of what? Child cannot write because of child is having behavioral issues. Such that when some children are even having ongoing medical conditions, for example. So, for example, behavioral issues now. A child may have constipation. A child can have headache. And because the child is not able to communicate. So a child having headache, what are you going to see? Behavior issues, crying, things like that. A child having maybe constipation, that's what you're going to see. So sometimes because people just put the diagnosis as a ceiling, they don't even begin to investigate that. Could there be something else going on? You understand? Because they've seen children who there's an ongoing medical condition, and that was also precipitating or showing as a behavior that would also show when a child is having meltdown. You see, because like I said, the manifestation can look the same. What we're dealing with may be different from time to time. So don't always say excuse a behavior. Don't always be too familiar. Oh, that's how the child is always doing. Oh, he does that all the time. Because there's sometimes that he may be doing that. There might be real issues that could actually be tackled to help the child improve. All right. He also stops us from being curious. All right. Instead, you just resign to some people have just resigned to their fate. All right. It caps potential as well. It's like you have accepted a limitation, or the child cannot write because the child cannot read. Then you just settle for that instead of beginning to think about okay, being curious. What are the possible challenges? How can we navigate? Are there other strategies to support? For example, a child is not writing. Can we begin to think about teaching typing, for example, while we're working on the reason why they are not writing? They're not writing. Is it the small muscles of the hand? Is it mitochondrial issue? Is it a palmar a reflex issue? What exactly it is? While you're trying to figure that out, okay, are there other ways we can teach a child to communicate um in written form? So can we begin to teach things like typing? Can we teach sign language? So that's the concept, what I call building a bridge. So there is a deficit or there's a challenge. You can begin to think, curiosity makes you think of, okay, how can we build a bridge? So you know what a bridge is now. A bridge connects two places together. But the goal of a bridge is to be able to get you from one point to another. So for example, someone that has a visual challenge, you're long-sighted, short-sighted. What are they doing? The spectacles or glasses they give is like a bridge. It still makes you functional, even though it doesn't mean that sometimes the primary eye deficit is taken away, right? Without the glasses, you may not be able to see, but with your glasses, what happens? You are able to see, you can be functional. That's a form of a bridge. So the same thing, if a child is struggling to write or can't write yet, it doesn't mean that you give up interventions that could support them. But while we're doing that, instead of just waiting and waiting on that, we can begin to teach other ways, things like typing, things like even some children will use the AAC device, the augmentative device, or teach sign languages, or you teach picture exchange communication. So the same thing with language as well. While we're working on language, you can build a bridge, find other ways of communicating and expressing themselves. So picture exchange, simply pictures or flashcards to communicate, gestures, sign language. And sign language doesn't have to be the standard sign language, just any form of sign language that can use to attach meaning to something that the child is familiar with. That's just it. So that's like building a bridge. The same thing with other potentials like reading and writing. Begin to build a bridge. So if a child cannot write yet, and they learn to draw, and they learn to draw to communicate, and they learn to what do you call it? Type, other things, forms of communication. You see, so while we're doing that, we work on that. So, for example, comprehension, when it's against higher learning, comprehension, other things, is struggling to write, teach them typing, teach them even if they can do voice prompt, if they have some form of language. Some children have language, they still struggle with writing because of muscle issues. Begin to teach other forms of expression, teach them painting, drawing to communicate. Then a child that learns to draw with time can learn to describe what he has drawn, right? So the goal is you want to teach something, understanding it, and being able to show that they understand. So if you're trying to test their understanding from a weakness, then that means your matrix of measurement is wrong. So some children that are testing that the child cannot write because you're using a wrong matrix to measure. So if you gave the child a question or a task and he couldn't write it, and you're using the writing to score him, but you bring typing and the child can type the response, that means the child knows it, right? So that helps you to shift your perspective instead of focusing that he doesn't know it. Because some children, you're staying on something, teaching them. That's why they understand it, but they may not be able to show you how much they understand. Just like children that have maybe expressive language delay, for example. Most of the time, they understand more than they can communicate. So if you're testing them by saying, can you tell me this? Can you say this? You're testing with a weakness. So just like testing a fish by its ability to fly. You already see that before even starting. I mean, your testing matrix is wrong. And that's why sometimes if as a parent or a caregiver, you don't learn to advocate for your child, you don't have this kind of knowledge and go to advocate for your child in certain, maybe in the school system. Some of these things, you're just going to be thinking your yardstick or matrix will be wrong. Do you understand? So yes, the school system, maybe officially in the education board, they have a particular matrix. But as a parent, you can go and advocate for your child, with some of these things, and you're not going to be under pressure because you will know that, okay, instead of just concentrating that your child is not learning, stay in the CVC word, cat sat on the mat, they're just teaching, repeating, because they are waiting for the child to be able to voice it to you. Sometimes the matrix can be showing, the child can show you, they can show by pointing. Even some children might not point, but you can see the direction their eyes will go. They can draw it. So that is the goal. Focus on the goal while you are working on the areas of challenge. All right. So the diagnosis can be autism, but that's just you don't just say that's how it is. Don't let your thinking stop. Let them keep being curiosity. All right. So like I've talked about the diagnosis dilemma. I want you to move beyond fear. Understanding diagnosis without being defined by it. All right. So sometimes parents, can share a common fear when it comes to diagnosis, but understanding these fears and moving through them is the first step towards empowerment. Okay. So why do parents fear diagnosis? I just share some of the reasons why some parents are afraid. Because you see some parents, they don't even want to go for an assessment. They don't want to get their child assessed because they are scared of a diagnosis. And I tell parents, you don't need to be scared of a diagnosis. Why are you scared? They are scared that, if I go for this assessment, my child will have this diagnosis, to not form this label. It's because you have a mindset that the diagnosis is a cap, a limitation. No, the diagnosis is not a ceiling, it's a starting point. You just point in the direction and begin to journey to help the child. So don't be afraid of it, because you've been afraid of it, you're not moving, you're not making it. How do you want to support your child? How do you want the school or the what do you call it, the educators to support your child? In some cases to be able to access resources or funding, you need a diagnosis because they need to have, a matrix they are working with. All right. So some parents are fear of labels, fear of something limiting their child. The truth is that while you cannot control what people would say, and I tell parents that, people will say this, either way, people will always talk. So don't make it about what people will say. Get your own perspective right, and your own posture matters. Okay, if you are walking around putting your head down like you're a victim and the whole world has crumbled on you, then that's what people would capitalize on that. People would always talk. There's nothing you do in this life people don't talk. You are brilliant, people talk. You are people would always talk. So you cannot live your life by what people are going to say. Are you waiting for people's approval? Think about your child and focus on people that are going to support you. Look for the right circle. Look for people that are going to encourage you. Don't stay in circles where people are talking. People will always talk. They're already talking anyway. So that whether you do the assessment or not, they're already talking. So just switch your mind off that. It's not about them. It's about the child. All right. So people are scared that once they're labeled, nobody will see their potential, that teachers will give up on them and they'll be treated differently. Forever. The question is, how are you treating the child? How are you viewing it? People would view your child the way you view your child. People will carry your thing the way you carry it. If you're walking around like a victim, then people will treat you like one. If you're walking around like a victim, you're not in denial. Yes, there's a challenge, but you're stepping up to it and you're navigating. So, what is everybody have challenges on their journey. What your own parenting challenge or your child's challenge is just different from mine. Some people's children are dealing with alcoholism. People's children are dealing with some underlying medical condition, heredity, this and that. Different things, different family dynamics as well. So everybody have their own package. Your own package is just different. So shift your focus and perspective and face the challenge heads on. So don't be afraid of the diagnosis. Some people are afraid of social stigma. So with or without a diagnosis, if people are going to stigmatize or judge you, they're going to. You understand? Your child is brilliant. They will still, some people will still judge you. What are they feeling like? They're feeling like it's all that. They will judge you. So, I mean, people's judgment of it is not based on what you have done or what you have not done, what your child has done or what's happening to your child or what is not happening to your child. It is them. So once you just shift that, it's their own problem. Do you understand? So it's not what you have done, what you didn't do, or what your child did, or what your child did not do, what is happening and what is not happening. No, you don't have control of how people choose to view you or view things. Okay, even if you go for an assessment and your child doesn't have a diagnosis, you can still judge you. People can still judge you. People will judge you for being different. So if it's about that, take off your mind about that. If not, you will never truly be able to support your child. That's the truth. Also people think about school acceptance challenges and all that. So whether or not you have the diagnosis, if there's still a challenge and people are going to support you, they will support you. If they're going to not support you, they will not support you with or without the diagnosis. So it has nothing to do with that. I think most of the time you need to deal with that mindset yourself. You need to deal with it. There's something in you that is viewing it that way. That working people are looking at you and maybe they're looking at you. Sometimes nobody's really looking at you sometimes. Sometimes it's just how you are viewing it. And we are projecting that to assume every other person is viewing that. And even if they are viewing that way, I mean, they're entitled to how they see it. Question, how do you see it? And just focus. Fear of losing hope. Oh, does this diagnosis mean that my child will never be able to do this? You understand? Sometimes grief over lost dreams. Yeah, I tell people that grieving and mourning are not the same. When you mourn someone who is actually like someone dies. That's mourning. People can actually grieve. It's not all the time that you're grieving that the person actually died physically. So grief just means that it means loss. And loss is not necessarily loss of life, loss of what could be, loss of what used to be. So somebody can actually grieve a marriage. Someone that loses a marriage, for example, due to divorce or um whatever reason, you lost a marriage, a relationship, you lose something, not necessarily someone, or you lose a version of someone. People can actually grieve. Someone has a spouse who maybe had a medical challenge or an accident and loses their ability to see. That means that you have lost a version of that person. They can actually grieve because life will likely not be the same, or you're gonna have to make certain modification and changes. So somehow they are grieving maybe the dreams they have or the life they thought that they would have with that person. You see, sometimes people can even grieve their own self. Like for example, maybe you've thought that, oh, by this age you would have this, you would have graduated, you with a PhD, you would have this job and that job, or you used to have this job and have this life, and now your life doesn't look like what it used to be or what you thought it would be. So you can actually be grieving that person that you used to be. It's like, so it's a loss. It's like you have lost that person. You are now a different person. You can grieve. Or the person you thought you were dreaming you would be by the time you're 30 or 40. Maybe you saw that you'd be married now with children and all that, and you're now a different version. You're not even married 40. So that person can actually experience grief. Grief of, not having that person or grief of losing that person. And now for parents as well, they can actually grieve. Parents who have children with developmental delay or a child that has ends up going through a medical condition and a child a child was talking before, all of a sudden the child is not talking anymore. So now the child can't interact with them like they used to. Parents can actually experience grief. They are grieving the lost child. The child is still here physically, but they have lost that child, that vocal active child, you see. So they can actually grieve. You understand? Yes. So it's actually real. So they can grieve maybe the lost dreams. They have pictured, oh, their daughter on the wedding day, it's going to look like this, going to look like that. So that grief comes like all those dreams, all those hopes, all those things are all lost. So that is a loss, a form of loss, you see. It doesn't necessarily mean it is they may not achieve it, but at that point in time, what they are seeing just feels like, oh, this kind of person cannot become that kind of person that I've dreamed in my head. So that's a form of loss, and it's real, and it's valid. It's valid, valid. And that's why when it comes to a diagnosis, there are different stages. I have a book called "Embracing the Journey After a Diagnosis." Yeah, embracing the journey after a diagnosis, and that's to help parents. And some of the things I talk about in the book are things like grieving the child that you wish you had or you thought you were going to have, awareness, and how you can move through the different stages, move from the grieving stage to stepping up to be able to take responsibility and helping their children and accepting, not necessarily accepting, like, I'm not saying you should accept defeat and lose hope, but accepting what the situation is now and begin to journey from there. All right. Yeah, so uncertain about the future and things like that. So when fear of diagnosis becomes overwhelming, many parents will fall into avoidance and the child will pay the price because that fear can become so overwhelming that it's like it paralyzes you, you will not even take any step. That thing that you call analysis, call it analysis paralysis. You think and think and think and think, and you're so down on yourself, you end up not even doing anything. So at the end of the day, the child is the one that would suffer because the parents will refuse assessment. All right, so that they were refusing evaluation for the child. They are just staying in limbo, so no clarity, no direction, no access to support and things like that, because even the school, they rely on you getting the assessment done so they can access resources. Then it delays intervention, and of course it's only the child that will the child is on the receiving end. The truth about diagnosis is that diagnosis is a tool, it's not a destiny. Okay, it's not a life sentence. Like I said, it's a starting point, it's a doorway. It opens up access, it provides direction, it creates a common language for those who want to help your child. So there's a direction, there's a common language, there's a process. All right. So a diagnosis is actually a tool. So it helps you to unlock services, things like insurance services, IEPs, therapy services in most countries. It gives a direction. So like I said, I call it a directional tool. So it gives professionals a starting point. So when professionals come together, we're able to have a direction, are pointing in the same direction. You understand? It helps to narrow intervention. It helps to make the intervention coincide. All right. So it's not that it's a determinant or it is a ceiling. No, it's a direction. Gives direction, gives clarity. All right. Then also by giving direction as well, we are looking at the context. Okay, when we have this situation, there may be other associated challenges as well that you as a parent may not know, but professionals will be able to know. All right. It becomes a communication tool as well. So it creates a common language among the professionals that are helping the child. It also helps even in the medical world, helps our research, it helps to find resources, it helps to connect the dots, different things. It also helps to connect families. So families are able to connect and be able to relate to certain things. Maybe some strategies have worked for them, they're able to relate, able to speak the same language and get effective support. So what diagnosis does not do? Okay, so common misconceptions. Many parents believe that diagnosis answers all the important questions. Maybe it may not. It does not predict the child's potential. It does not determine what the child can or cannot achieve. So that's why I said don't just say put a cap because of the child cannot do. There may be things associated with that condition that may be preventing the child. Also, you can't say never. Never say never. That one child cannot do something doesn't mean another child cannot do it. I always say it again that I don't play God as a professional. I will tell you, according to my professional expertise, this is what I know, this is what I know, this is what the research says. blah blah blah. But that is still not a ceiling. All right. So it doesn't tell you the root causes of the challenges. It doesn't provide specific intervention plan. So what I mean by that, the title, just say speech delay, autism. You can't say, okay, autism, then this is the intervention plan. No, because different children may have the same diagnosis. Intervention plan is now being able to drill down the areas of challenges and customizing it to the child. That way they will say that you need to customize the plan to the child. Even in school, we have IEPD, individualized educational plan. So that's why it is individualized. Even when it comes to therapy, that's why they have to do an assessment so that they can individualize and customize the plan to the child. And for parents, parents of faith, I'm a parent of faith, I'm a professional in faith, okay? So, for parents who are, who say they're standing in faith, God forbid they don't need the diagnosis. What I always tell them is this, the diagnosis is not the enemy of your faith. Your faith needs a target. Your prayer needs a target. So if you say you're praying, you're praying, you're standing in faith, how can you pray if you don't even know what you're targeting? If you don't have a name for what you're targeting, are you just praying every this, every that? Then your faith has no direction. That is fear-based prayer. So a diagnosis is not the enemy of your faith. It just gives you something to name, something to target. So your prayer will have target. You're praying for this. You're believing God for this. You see? So your faith has a target. It has a direction. You're not just directionless. Your prayer has a target. So without clarity, what are you really praying for? What are you praying for? Like in the Bible, when what do you call it? The blind Bartimaeus in the Bible, when he was shouting, Jesus was passing, say, Jesus, thou son of David, have mercy on me. Jesus said, what do you want me to do for you? So let me ask you, if you're a parent of it and you have the opportunity, and God says, what do you want me to do for you? And if you don't have clarity, what are you going to tell him that you want him to do for your child? What are you expecting? So if you're saying that I'm believing for what exactly? If you don't have clarity, what are you praying for? How can your prayer have targets? How can your faith have targets? All right. Diagnosis does not oppose faith. So diagnosis is not the enemy of your faith. No, it just helps to give your faith a target, your prayer target. You're praying for this. You can be specific, and even if you're even the professionals, you're able to pray, that God can guide the professionals to help with this, guide the school to help with this. You already know what you're dealing with. You now know the kind of school and resources that you need. Sometimes you even need certain resources that maybe they're not available in your environment. You're able to pray correctly, and God can bring those resources to come your way or align with you with people with those resources. All right. So faith with your diagnosis is a powerful reframe. So don't say, so the old perspective is diagnosis is the enemy of your faith. Like, you just accept the enemy or saying God forbid or things like that. No, shift your perspective. Diagnosis is the target for your faith. I believe that God can help my child with so. Or if you're praying to God for so. Yes, you can be specific. All right. You can pray, you can plan, you can partner towards specific outcomes. You're specific. So you need to be able to name it to tame it. Yeah. If you cannot name it, then what are you targeting? What are you hoping to? It's not like you're taming the child or anything, but that's just like, the essence of naming to tame, meaning that if you can name it, you're able to focus. You're able to focus whether your prayer, whether your research, whether you search for resources, search for answers. You're able to search for specific answers. If you're asking for help or asking people, you're able to be specific. Okay. So clarity is not the absence of faith. It is faith with direction. You have direction and you're specific. All right. So most dangerous thing about a label isn't just the label itself, it's what we do with it. So when parents and professionals use diagnosis as an explanation for everything, investigation stops and ceilings are built. That means you just excuse everything. We can't do this because of this. My child is not reading because he has autism. My child is not speaking because they have autism. My child has behavioral issues. No, each of these statements, it just stops curiosity, stops investigation, and just assumes and limits the child. All right. Okay, I've talked about this, about assessment, about parents being scared of assessment. So I'm talking about, for example, from labels to reality. So for example, a child that is not reading, is it a visual issue? Is it a hearing problem? Is it a curriculum and environment? There may be different reasons why a child diagnosed with autism may not be reading. So this is an example. So don't assume that, okay, it is autism, then You have stopped investigating that the child cannot read. They say, oh, some children with autism, they don't read. Just stop like that. Some children. Who says your child is part of some children? There may be some children, but have you explored all the possibilities? Okay, when you begin to investigate or have curiosity mindset, you have deeper assess. Begin to have deeper assessments to review things. So things like convergence issue. Convergence has to do with how your eyes work together. So some children have convergence, what we call convergence insufficiency. So that means that the eyes cannot function and track together. That for those kind of children, they don't really see clearly. They can see and walk, but when it comes to reading, the way the eyes are supposed to converge together, they have challenges, and that way they will struggle to read. All right. So things like vision therapy and things like that can assist such children. So these are just case studies. For example, a child is hyperactive. Don't just say, oh, just ADHD with autism or it's hyperactivity. Some children with autism have a hyperactive and things like that. Begin to think about it. There's an investigative mind. Some of the things you may notice is that okay, they maybe have what we call auditory hypersensitivity. The classroom may be slightly too loud or too noisy. Even the home environment. Some of us are playing music in the background or things like that. So it makes the child, overwhelmed, their nervous system, hyperactive and things like that. But when you're able to drill down beyond the hyperactivity to like what is going on. This is just an example because things could be going on externally or even internally for the child. For children who have hyperactivity, could be internal in the body, could be external. Internal could be diet, could be interoception. Interoception has to do with the regulation of the internal, what we call the internal milieu of the body. Some children as well, maybe they have constipation or they just feel unwell and all that internally. So it can be hyperactive and be very restless. It can be external as well. But the point is, don't just say, oh, children was in hyperactive and just stay there and not think, okay, what are the ways you can support them? For example, if this auditory issue, the environment being overwhelmed, you can create a sensory-friendly environment, okay? The children can use noise cancellation headphones in environments where you don't have control of changing the atmosphere or reducing the noise in the atmosphere. You can use things like noise cancelling headphones. You can make the classroom more friendly. You can, if you have options of picking a school, you might pick a school with a smaller environment or have smaller fewer students. May not be as overwhelming for your child as well. Okay, so things like that. And so the beyond labels approach is this. What I like to call the beyond labels approach. Approaching a child with developmental delay or autism is this. Observe the challenge. Describe what you can actually see. What are the specific behaviors? What are the specific struggles? Not just that he has behavior issues. Part of the things with behavior is that there's what we call a behavior support plan. So you can track behavior. Some behaviors have a pattern, a time of the day. Sometimes maybe some parents will say before bedtime, some parents will say after school, sometimes in certain environments. So if you see a pattern, it could be something that is precipitating it or making it worse, that if we change or reduce or redirect, maybe to manage the behavior. For example, some children, when they are hungry, they have behavior issues. So I have some clients that after school, you notice that the child is always having that behavior around a certain time in the afternoon. And I'm like, when last did the child eat? It could be hunger. Because when you can have hypoglycemia. So when your blood sugar is low, you're having headache, you're just, you know how you feel. So the child can just have behavior. So what did they do? They have a structure in which they infuse form of something to eat at a particular time. And that's why as we begin to empower the child, you can introduce things like having a drink in the bag. So that way you can go and advocate for your child in school. You see what I'm saying? Instead of the school saying that, oh, lunchtime is 12, or no snack till 3, you know that your child likely have hypoglycemia. You can go and advocate to have like a snack in the bag that either the child can easily reach for or they can give the child at certain times. Also taking breaks. Some children don't do so well with long hours of activity, no system of rest. So you can infuse and advocate for them. Check the schedule they run in school, advocate for your child to have breaks. Also infuse things like siesta in their day. Even if they say they don't want to sleep, they just lie down. Infuse things that can help the child to just relax, to calm the nervous system before the behavior. So things like observe the challenge. So investigate the root cause. What is the why? Why? Keep asking why. Keep asking why, instead of saying or it's because of this diagnosis, okay? Then address specific barriers. Like with specific barriers that I talked about, environment, even if there are core issues, when you still put therapy and intervention, there are things we still have to put in place. You still have to put it in a friendly environment that helps support the child, supports calm, supports love, supports inclusion, supports acceptance, supports them feel safe, feeling seen, you understand, feeling like they belong. Do you understand? So even if they are not, these are not the core issues, but they will still, you still have to incorporate it into whether any form of therapy or intervention. All right. So don't blame the diagnosis. Just try to identify specific support that you can put in place. Even if some things cannot be eliminated, like I said, you can build a bridge, you can look for alternative, or can just make the process easier. All right. So moving from labels to skill, that's what's really going on. So when you stop asking what's the diagnosis and start asking what skill is missing, what's the why, what's missing, or is there something that we can put in place, to begin to help the child. So the core message is don't focus on the label. Okay. So the children are not just struggling because they have a label. The label is describing a pattern, it's explaining something. All right. So when you focus on the label, it's not really explained anything and it's not empowering for the child. All right. Look for missing skills or skills that can help a child. Because when children, when you say a child has developmental delay, meaning that the milestones they should be achieving for their age, they are not. Okay. A child is 10 but has a language of maybe or communicates like a 3-year-old. So they're not gaining those milestones, right? So they're not gaining it's not that a child outgrows things, they build skills and able to function at a higher level. So sometimes when those skills are not being built, or they're not acquiring those skills as they go on easily. That's when there's a delay. So what do we now do? Now bring therapy in. Sometimes therapy is looking at, okay, is there something that is impeding them from being able to gain these skills easily? Or we need to now do extra to help them, or we are building a bridge to compensate, like what I've explained before, to compensate. Because some of these things, okay, maybe we cannot fix it, but can we look for compensation? So using things like PECs to communicate, sign language to communicate, using the AAC device to communicate. That's like building a bridge to still help to communicate. All right. So thinking from that perspective, look what the missing skills. Are there missing skills? Are there things that we could begin to add? Are there underlying factors? Because sometimes we may be seeing a manifestation in one place, but there could be underlying factors in different places: nutritional, sensory, hereditary, environmental, you know, those things, emotional, they could be worsening the outcome you're seeing, or maybe impeding the ease with which they learn. So, for example, if a child is not settled internally, they have constipation, headache, and they're not settled, they can't learn. So, no matter how much therapy, even the therapy, they won't be able to engage. So, that means you can't even really maximize it. For you to be able to engage, you have to be present, you have to be aware, you have to be regulated, you have to be calm. You see, so when you focus on the gaps instead of just the diagnosis, you're able to unlock real potential. All right. So look at, for example, a child is pre-verbal. I don't like to say non-verbal. People say non-verbal. I like to say pre-verbal because for me, you never say never. Pre-verbal. I've seen someone gain language at 16, 21, even 27. I have seen that. So I would like to say pre-verbal because they're on their journey to acquiring language. I know some people use things like, oh, whether non-speaking or all those things. Well, whatever. I would just say I just say pre-verbal, okay? So the label, whether it's a non-verbal or pre-verbal, is not telling anything about why a child is not speaking. All right. Could be different reasons. For example, child is not speaking. There are things like apraxia, where we have a motor planning issue, where the brain struggles to coordinate the movement of the muscles, the movement that is needed for the muscles of the mouth to make speech. So that kind of child sometimes may understand, but because they are not able to coordinate that, you may see that as a deficit. Just like someone that has stroke. Someone that has stroke, for example, they struggle to speak, but they understand. So if you're measuring them by the expression, you see, you're using a what do you call it, a weakness. All right. So a child who is pre-verbal or has limited language could be an auditory processing. Okay, he hears, takes it in, but struggles to process and convert and be able to respond, or takes time. Some children have expressive language delay, meaning they understand, but being able to express themselves, they may not be able to express as much as they understand. Or some children have what we call selective missing. That can be anxiety driven. But sometimes maybe that kind of child speaks in some settings they don't just speak. So different reasons can cause. I'm not going into what is causing all these things. I'm just trying to explain for you to understand that when you just focus on a diagnosis, there are so many areas that you may be missing. Because some of these things, when you identify them, there may be certain strategies that you use to support these children. Let's move. All right, so things like apraxia, oral muscle exercise, AAC device, sign language, auditory processing, using PECs and anxiety, able to build emotional safety. Also, even things like looking at their primitive reflexes for anxiety to be sure that all their childhood reflexes are not retained and things like that. So ensure that their nervous system experiences calm. So talk about reading. So different reasons why a child is having difficulty reading. Could be eye tracking issue. See, sometimes you use the wrong curriculum, sometimes the executive functioning issue, sometimes the convergence issue of the eye, sometimes auditory processing, sometimes the wrong teaching method. You are using a left brain method to teach a right brain learner. Sometimes it's even the environment is overwhelming, the child is not settled. See, methodology, curriculums, different things can affect a child's ability to read. So if you focus on the diagnosis, then you may be missing a lot of points. So things like eye tracking, vision therapy, for right brain learners, we use things like flashcards, things that are colorful, you know, understand how the child learns using multisensory curriculums. So now that the same challenge, same manifestation, right? We'll have different things going on. So the strategies will be different. Okay, see behavioral issues as well. So it shall be manifesting behavioral issue, maybe an external issue, maybe an internal issue. All right, maybe because they struggle to communicate, there could be a underlying medical condition. I mentioned that, like constipation, headaches, or that thing. With sensory overload, too much sound, noise in the environment. It could just be that their needs are unmet. I mean, different reasons why they're having all these things. So you have to be able to. So if it's a communication issue, build a bridge, teach them how to communicate while we're still building words. You can build a bridge using sign language, text, different things. If it's a sensory issue, you need to modify the environment so that you're able to regulate their nervous system. If it's a medical issue, could be allergies, could be nutritional deficiencies, gut health, treat it or attend to that medical issue. Because some medical issue will require treatment, medication, or whatever. For the medical issue now, I'm talking about the medical issue that is causing the behavior you see, the medical issue. So if it's a medical condition that requires, attention or treatment or maybe changing diet or lifestyle, you need to address it. So a child that is hyperactive, for example, now could be poor sleep, food sensitivity, sensory sticking, could be retained reflexes, could be screen that is overstimulating, different things, could be toxic, overloading the environment. So putting the right intervention in place, you know, will work. So you can't just say, oh, every child is because of screen, every child is because of his nutrition. It's just there's no one size fits all. So that's why I don't just carry one supplement or one nutritional plan and it's for everybody. Yes, everybody would benefit, but that may not be the core. You may be missing some other things. All right. So when it comes to looking at the skill gap framework, you're thinking about, okay, what is causing the gaps? Could there be is there a missing skill? Is there anything blocking their ability to acquire the skills? Are they missing foundational skills that they have to now build on? It helps us to just think in that area. So I want you to have a layered approach. Layered approach, okay. Think about the foundational things like what do you call it? Things like the nervous system, ability to regulate, ability to communicate, ability in movement, things like that, social skills, emotional regulation, then academic and complex independence. So this, for example, now you see some children who maybe they are struggling to read now. Reading is more an academic stuff that you see in school as a challenge. So if you're just trying to fix from that point without looking for a foundation, if a child's nervous system is not regulated, if they can't be present, if they can't focus, can't engage in the environment, they can't even start to learn. There are things we call learning to learn skills. There are prerequisite skills to learn. So if a child is not even aware of their environment, they're in a place they're not even aware. You come in, you make noise, they're not even aware. That means they cannot even be present to engage the environment. Learning cannot even start. So you can't start saying, that child is not reading, he's not learning. No. Even if he starts learning and start talking, he's going to be cramming. I have clients who say, oh, my child can read 1 to 100, can say all the colors, can say all the alphabet, is not talking. And I said that a child can say numbers, 1 times 1 is 2, or say all the colors. It's not a measure of intelligence or progress. Most of the time, it's just cramming. Child is just cramming. All right. So you don't use that as a yardstick. Do you understand? So that's why foundational skills have to be there. All right. Then I believe communication is not necessarily the words first. Some children have more words than some other children, but yet it's not a measure that they are more advanced in language development. All right. Because communication is beyond the words. So a child can communicate maybe with gestures or understand cues, go and bring this, put this ball in the box. The child can do it. But another child can sing and everything, but yet cannot follow instructions, cannot understand. That's to tell you that they are just cramming. They are not really engaging in what they are learning. You're right. So you cannot focus on the reading first without talking about all the foundational skills of the regulation, being present, being able to coordinate their body, being able to focus, engage the environment, being able to be aware, understand social cues, all those little things. And that will also start at home before a child goes to school. So that why sometimes, because some parents may not know what to look out for in the foundational years, they focus on the wrong things, by thinking that, oh, you put the child on the screen, he's going to learn the language, he's going to learn to read, and not knowing that the core foundational skills to build reading, writing, and all those higher functioning skills is not necessarily by putting the words in front of the child or the screen in front of the child. No. Okay, so talk about hyperactive child. I don't want to go into that again. So changing school, okay, maybe we say more of a place-based learning center, consider sensory activities, modify the home environment, and partner with the therapist and all that. So a child who was out of control. So this is like a case study that I'm just as an example. A child who was hyperactive, instead of just thinking, okay, it's autism, let's just manage it. If you think in terms of curiosity, okay, what's causing hyperactivity? You start thinking the home environment, is it structured? Are there excessive strains? Is it hyper stimulating, overwhelming? Think about the sensory needs of the child. The child getting enough movement, play and things like that. Because play is one of the things that builds the brain, and also one of the things that synchronizes both sides of the brain. Okay, so when you're going to think about that, okay, maybe the school environment the child is. Some people you put your children in school environment where they don't play. They don't even have a compound. I don't know how that works. Children need play. So play-based learning, project-based learning. They do a lot of outdoor, use, a lot of things to teach, to engage the child, to build the child skills. They remove screens and they put structure in place, correct tools, right toys, and in place. There are certain kind of toys that are the right toys. I wrote this book, Toys That Teach. And in this my book, I talk about all the kind of toys that children should be playing to enhance learning and development. I also have this book on play, the play manual, talking about play, how you can all the different kinds of play and how you can use to enhance learning and development. I also have a book on raising bright readers, all the kind of books you should be reading to your children to enhance. So all those things, they are tools, even when a child has developmental delay. That's why when you go for therapy, you notice that the therapists, what do? They bring toys and different things. They use them as tools to teach and engage the child. Remember at the beginning, I was saying that you don't learn language in isolation. You do anything you're teaching a child that has a delay or has autism, you are not learning in isolation. You're learning it so that they can understand and use that knowledge and that skill to interact with the world around them, right? So here, a child who was out of control now became focused, is now thriving because we're able to piece out what are the areas of challenge and put the interventions in place. Okay. So like I said, think about the hidden layer, what's affecting the child. Don't look at the surface behavior. No, what are the layers of things that are happening internally, externally? All right. So like now, neurological. You're thinking neurological, then you're thinking about the nervous system, reflexes, sensory, the environment, light, sound, how everything is structured. Number two, you're thinking about the gut, the diet, nutrition, because when you have nutritional deficiencies or dietary food sensitivity, all those things, and that's why you hear the gluten-free, casein-free diets tend to be popular. All right, because some people react to gluten and casein, and it causes what we call like morphine-like effect. The effect of morphine on the brain or activating the dopamine centers. So some children react to it. So emotional regulation as well. So we think about the family dynamics, trauma, attachment. Then of course we now think about the methodology. What methodology are they using? What kind of school environment are they? what is their learning style? Are they using that method to teach the child? All right. Then you think about movement, sound, how they engage them. So all these things, you have to look at the child as a whole. When there's a problem, what are the different areas? Like I mentioned, neurological. Think about the sensory, the environment, the nervous system. Are they hypersensitive, hypersensitive? Think about the diet. Think about the environment. The environment has to do with both internal and both physical and non-physical environment. Because physical is what you see. Non-physical is how the environment is, the home environment. Is there a lot of love, or is there toxicity? People are fighting, arguments. Is there acceptance? Is there, things like that. Emotional regulation, things like that. That's why bonding comes in. So that's why when we say don't abandon your children too early, so drop them in crash, or just abandon them with someone. I mean, children need that what we call attachment theory. The primary caregiver, particularly the mother, of course, as much as possible, the exceptions, to provide emotional regulation and stability for them. Because some children are having behavior issues, some of them stems from that abandonment when they were younger. So that abandonment, and the child cries and cries. We have a culture where you say, let the child cry, the child will be all right. Do you know that crying and crying is a form of stress for the child? So if your child cries and cries, that means that your child was crying for you and you were not there. It's a form of abandonment, it's a form of neglect, a form of abuse. So the child tends to have this dysregulation in the nervous system, dysregulated. They tend to be like, how do you call it? Like, it's just like saying that you're on the edge, you're on the edge. So living life on the edge. Some of us, I mean, you grew up with your parents being very, very tough, and they shout, so any small thing, you get very agitated. So that happens with babies or children who are left um out of the care of the primary caregiver too early, or even if you are there, they're always crying. You leave the child to cry, you'll be okay. What you are doing by doing that is you are making the child dysregulated, because the child learns regulation from you. You see, the more don't say gum body. There's something like a child is gumming body. You carrying the child, soothing the child. That's how you teach how to regulate. So children don't just learn how to regulate because they are growing older. The safety you provide, the so-called the reassurance, that's what teaches them to regulate. That's what helps them to know that they are safe. That a baby spends 9 months in the womb. When they now come into the world, so it's like I've been in a very cozy, how you see those pictures of the scan, very cozy inside the mother's womb. Is warm, and I don't know whether it's warm, but I know it's dark. You know, So now imagine I've been in that place, cozy. All of a sudden, you just come out into this whole world. It takes a while for them to adjust, because they've been in the safe place. They've not thrown them into like the wow. So it takes a while. So sometimes every time they cry and they cry for you, you need to go there and give that reassurance. That reassurance. So with time, they tend to losing and feel safe in the world. Do you understand? You provide that reassurance to that feel safe. When you just say, let the child cry, 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 cry. So it's like the child cries, and the child, feels like you're thrown into the world, and you see agitation, you see all those things. Yeah. So, like I said, other things, the teaching style, you understand. So most interventions want to address one layer and ignore others. So you just want to do switch delay, just do speech therapy, just change the diet, just do ABA therapy. No, I would always say it is not just try to fix one thing. Because somebody said I did this and this didn't work. You just want to copy and paste, and it doesn't work that way. All right. So don't just say I'm just doing speech therapy, okay? You're just addressing communication, where you are ignoring other things that affect communication. You know, their auditory processing, hearing, reflexes, motor planning, sensory issues. All this affects communication, because communication is not in isolation. If you don't hear well, you cannot communicate properly. If you're not regulated, you can't be present to communicate and interact in the environment. Don't just change, we just want to address nutrition and gut. So you're not thinking, even things like sensory issues and other things like that, environment issues, think about food allergies, other things like that, nutritional deficiencies, and are there also food intolerance and all those kind of things. Then don't just do ABA to correct behavior. When it comes to behavior, you need to interpret behavior, because every behavior is a communication. So it's not just about I want to just stop the behavior, just want to stop the child from doing it. No. Every behavior is a communication. The first thing that what is the child trying to communicate? So interpret the behavior, then put the correct intervention. So if you interpret the behavior and you see that there's something causing, okay, can we modify? Can we redirect? Can we begin to teach other forms of expression? Things like that. That's what you think about. So that's the goal, not just stopping the outcome or fixing from the outcome. So the whole child approach, you think about all these different areas that I've mentioned. All right. So that's why in your toolkit, I don't believe in just selling one solution. Someone says just one supplement, they just want this. So I don't believe in that. All right. For me, what I try to help parents look at is I look at the toolkit, look at the whole child, look at all the different aspects, not just sell one thing, look at all the different layers, the medical, sensory, the learning side, the environment, developmental knowledge. So, for example, developmental history, it matters. Things like crawling, some children did not crawl, and that can be a big red flag. Not all children, but they can leave some gaps because crawling is one of the things that builds brain. So, cognitive reflexes, nutrition, behavior, different areas, look at it as a toolkit to assess, in different layers. I like to look at different layers um to be able to map out a plan. Okay. So like I mentioned why therapy doesn't always work. So some parents will be exhausted, we've doing speech therapy for 2 years, no progress, we've done ABA, we've tried this. And the question is not whether the therapy is not working. The question is the therapy the problem? Is there something else going on? All right. So there are some reasons why therapy may not work. Some therapy are good therapy, but may not be the right therapy and may not be layering correctly. It may not be delivered in the right method. So, for example, you're trying to teach a child to read, you're using the wrong methodology, wrong style of teaching, wrong environment, you're not considering sensory issues. The lack of readiness, sometimes the child is not settled yet, so the prerequisite skills are not there. The foundational skills are not there, so the child is not really ready for the higher skill. Maybe based on the age, I think because it's 5. You can't just start from 5. If you have not built the skills that you're supposed to build for 2, you need to go back. So, for example, a child, before you talk about walking, head, neck control, sitting, um, crawling, standing, they are prerequisites to walking. So if you have a 10-year-old that is not walking, you're not just going to say, okay, we'll start teaching walking. We'll go and check all the foundational skills that they there. If not, if they don't let control, that's where we're going to have to start and build. So also, you may be trying to fix from that point. So therapy is not going to work. All right. Then also parental involvement. I would always say something. Any therapy that does not involve the parent, I don't think it's an effective therapy because at the end of the day, therapy is not meant in isolation for therapy room. Whatever is taught will be transferred to everyday life interaction for the child to gain opportunities of practice, gain mastery, and be able to generalize. And who can do that? Most are the parents or the caregiver because they are with the child most of the time. So when they are carried along, they can transfer what is taught in therapy room or therapy session to everyday life and people come and give the professional feedback and they can work together effectively. All right. Then I said fragmented approach. Sometimes if the professionals are not working together, OT, ABA, everybody just doing their own thing. That's why usually even if you have more than one profession, usually they work together. That's why you have a plan. And that's why we're talking about having a diagnosis. If you have a diagnosis, we have a target, we can all work together. Sometimes they can even have sessions together. They can have sessions together and be able to help the child holistically. So for example, ABA just want to fix the behavior instead of just working together. Okay. So parent as the coordinator, like I said, the parents are the central person, you're the central hub. You make all the decisions. You determine the professional, determine the school. So I believe that the parent is the core. You understand? You're going to align the team, you implement at home, you guide everything. All right. So trust your instincts as a parent. All right. If you think something is not working, go back and reevaluate. Find out what is happening. What am I getting right? You understand? You can switch therapists, you can talk to your professionals as well. All right. Then progress is not always linear. Sometimes you need to take a step backward, have realistic expectations, measure progress realistically. So sometimes progress is not always linear, not one way. No, and it may not always be from an output point of view. Sometimes consolidation is taking place. There are skills that are being built that you are not seeing. All right. And so if your child is not progressing, don't before you give up on therapy or approach. So investigate these 5 questions. Is the timing right? Are foundational skills being built? Is the method right? Is the child ready? So these are things that you can always talk with your professional. So that's why, like I talked about, being able to partner effectively with your professionals, whether it's therapists, whether it's the educators, Then are you involved enough as a parent? That's another gap I always see. When professionals, therapists, educators give parents, give you tasks, do this, and sometimes parents are not doing as much. They may be doing their own part. They also need you to do your own part because you are the pilot to make a lot of decisions, and you're the one that will help the child to translate the skills at home. All right. So I just want us to have a paradigm shift today. Instead of thinking that my child has autism, they can't do this. Diagnosis is now forming what the child can do. No, you just accept the diagnosis. When you talk about acceptance doesn't mean that you accept the diagnosis as a limitation, as a cap, as they say. No, you accept it as a starting point, as a door, as a giving direction. So acceptance doesn't mean you accept and stay. Acceptance means that acceptance means awareness, clarity, and now begin to take a step in the right direction. So have a new thinking. If your child has specific challenges, let's investigate the root causes. Diagnosis is a tool, it's not a ceiling. Look at the child holistically. You as the parent are the pilot, you make all the decisions. All right. So diagnosis is directional, it's not determinative. It's a starting point, it's not a life sentence. You cannot help each other from just the point of diagnosis. You need to drill down what is going on and begin to, because same diagnosis, same manifestations may need different strategies because of the underlying issue. So look at the child holistically. Don't just try to isolate one segment. Say, okay, this supplement is used for speech. What supplement can help a child with speech? See people talk about it. Yeah, there's something that can help a child with speech, but not in isolation. Sometimes there might be other issues, and sometimes the child may not even be deficient in that nutrient. It may not be this a nutritional uh, a deficiency issue. The supplements would help, just like any vitamin would help you, but there might be other core critical things that you're dealing with. All right. So when therapy doesn't work, don't just keep going, investigate, ask questions. So that's why partnering effectively with your therapist is very important. At the start of therapy, usually when they do an assessment, they explain to you and they have goals per time. So you need to be involved. Don't just say, oh, we have paid, you're doing it in school. Sometimes I ask parents, what are they doing? Say you don't know. You need to be involved, go to school, ask questions. But there are ways to do it too, not in a very disrespectful or demanding way. No, in a way that we're working together. You understand? Carry them along. You can also share things, challenges you're having at home. They'll troubleshoot for you. They can create resources for you. Partner effectively. So behind the label is a person. Look at your child. There's a person behind that label. That child is a person. He has unique gifts. He has specific needs. He has gifts. He has potentials as well. So don't just always tell parents that everything's about as if there's no person. There's a person. So why sometimes when a child diagnosed with autism does something, I said that is a normal. I mean, like, it's not out of place now. If this kind of thing would upset anyone, wouldn't it? So the child was upset. So why are you thinking that? Always attaching meaning to everything the child does. There's a person that has needs, a person that what do you call it, that can also get upset, a person that you can also overstep your boundary and is going to react. There's a person that wants to also have the power of choice. It's just that the way he or she can do it is different. He may not have words, but you can show him, do you want this or that? Not that you say, just feed him, yeah, eat rice, sit down there, and all that and all that. And when your child is getting older, you start seeing some behavioral issues, and you're complaining, and I'm like, it's a person. Don't worry, maybe tomorrow and next I will share more on some of these areas, because this is something in recent times I've been dealing with. I've been seeing very common with a lot of parents who are having their children getting older. They're seeing some behavioral issues, and I'm like, I have to start educating them that there's a person behind. Um, I mean, in there, there's a person in there. You have to recognize that and treat your child like a person that deserves respect, that deserves honor, that deserves to be spoken to. Even if they don't have words to respond, you still treat them with dignity, with respect, and not just toss them around and shush them and just force food down that. I mean, anything goes. No. So I want you to I take a few minutes to reflect. What label have you placed on your child that may be limiting them? What are you blaming on diagnosis that you should investigate? Meaning that things like, okay, your child not reading or not doing certain things, that you feel that, okay, you have just assumed that it's because of the diagnosis. You have never really taken time to investigate, ask questions, or even talk to professionals about it. So what layers you have not been addressing from all the areas that we talked about? Are there areas you have not been addressing for your child? If interventions are not working, what might be the mismatch? Have you ever thought about it? Have you looked into it? What would you change if you saw your child as a person first? Are there things you would change on the journey? So tomorrow, we'll continue tomorrow. Tomorrow is going to be very interesting. I'm going to be having a mother here whose son has moved from non-verbal to fully conversational. He's one of my clients, and her son had moved from being hyperactive to be focused, to be creative. This was a boy who couldn't read, restless all over the place. Now he's reading fluently. He has moved from special ed class to mainstream class. This doesn't mean that, okay, this is going to be 100% everybody's reality, but tomorrow is about stories of hope. Every year, I dedicate one day where I share stories of hope, and that is to give someone hope and to see that where you are currently, someone was there, and to see the power that a parent has in really helping their children to navigate. Okay. So what made the difference for her was that she became an empowered parent. She moved from being overwhelmed to empowerment. She moved, to the point of she had the grieving stage. Then she moved to the awareness, acceptance. And like I said, acceptance is not I accept and I stay. No, you accept and become empowered and take the front seat and start to find out. And she started looking at all these other areas, not just that the child is not reading, is not listening. No, you will hear more about it tomorrow. So you will learn more on how she did that for her child. So I want to say behind every label is a person. Behind every diagnosis is a child. And behind every child is a parent who has the power to change everything. Okay, I know God is the one that is the Almighty, but God has entrusted these gifts into your hands, and in partnership with God, with also all the professionals and all the tools and resources He has given mankind and has made available. Truly, as a parent, you can step up to become empowered, partner with the professionals to help your child to navigate and to thrive. So thank you very much. Here are my handles, autismrenewed.com. You can follow us on social media. Tomorrow will be day 2 of the conference. I don't know if you have any questions. If I can take a few questions before we go. I don't know if I can take a few questions before we go. Let me just have a water break. My throat is dry before we go. I'm not seeing any questions. I'll just take a water break. Okay. I'm not sure. I cannot see any questions. Do you have any questions? Or you drop your questions if you have any questions. Um, okay. Okay, so just round up in a few minutes. Okay. So let me see. There's a video that I actually want to play. I'm not doing sure if I can. Thank you. Thank you, everyone. I see you're in the comments section. Thank you, everyone. The video I actually want to play. I don't know if it's good, if I'm going to be able to play it, but we'll see. Okay, if you have any question, let's just drop our questions. There's a video I just want to play. I want to see if I will be able to play the video. What happens when your child isn't meeting their milestones? When your child, like your child isn't talking like their peers, having behavioral challenges, not following instructions, or having learning difficulties. Or maybe you are currently navigating a diagnosis such as autism, speech delay, developmental delay, or even a learning disorder. You're trying to make sense of why your child struggles to attain skills that come so easily to others. Or do you find out that your child has been in therapy for several years, yet with little progress? This has left you with more questions than answers. At Autism Renewed, we see you and we are here to help. Hello, I'm Dr. Lola Okeowo, a medical professional and a global autism expert. I am the founder of Autism Renewed, an organization that works with parents and families all across the globe, equipping them to navigate developmental challenges. What happens when your child isn't meeting their milestones? Okay, so thank you everyone, and I don't see any question. Someone said my son complains of overwhelm. What kind of overwhelm? How old is your son? Complains of overwhelm. Can you define what you mean by overwhelm? He's a kinesthetic learner. What do you mean by overwhelm? I didn't need to be specific. See, that what I was saying. Sometimes we can, finally you heard me say, oh, can you explain what overwhelm means? Can you explain what overwhelm is? Ma'am, can you just explain further what you mean by overwhelm? So give a scenario, what you mean by overwhelm. Because when you just say he complains of overwhelm, hmm, can a little boy really use that word overwhelm? So what word, how does it describe it? Because sometimes you need to understand what he's really saying. Overwhelm can mean that I'm tired, I want to sleep. Overwhelm might mean like, if for example, is it that when he's doing homework, I don't understand his homework, the child might say that he's overwhelmed. It might be that he wants to sleep or he's tired. It might be that he's even hungry. It might be that he wants to take a break. You see, that can mean different things. So you really need to, that's why I talked about being able to drill them what exactly is. When if I'm saying if I'm using overwhelm from a professional point of view, I'm talking more that you will see that what do you call it? It's more of the nervous system, you know, that overwhelming feeling. So, for example, maybe you're in the stadium, you know how the stadium, imagine they're beating drum, they're singing very noisy, and I'm trying to get you to, how overwhelming it can be. Very like you just have this. It's like your head is kind of like spinning over my head. That's what I'm talking about. He's 6 years old. You could be in a class, and next thing he says boring, not interested, and it's gonna. Okay, this person, I don't know. Did you attend learning style course? Because I can see that you're saying it's kind of aesthetic learner. Did you understand? Then there was a life I did that I don't know if this person is in TIP attended the course. So boring can mean different things, not interested and disconnect. So when it comes to that, that can be due to different reasons. So um there's a learning style course that I did for Intentional Parents Academy, but on the Intentional Parents Academy YouTube channel, if you go there, you see about, I think about 3 weeks ago or so, I did, if there's a free video there on understanding learning gaps. So there could be different reasons why your son is feeling that, and I'll just summarize there. So for your son, it could be different reasons. It could be that the environment may not be friendly environment. If it's a kinesthetic learner, for example, they may not be given enough breaks in class, because for a 6-year-old is supposed to be running around and be playing. But putting a 6-year-old in class, I mean, for 1 hour, 2 hours, no breaks, and also the teaching methodology. The teacher may not be teaching with his own style. The teacher may be using a methodology that he doesn't understand. So that's why he's saying it's boring. So when a child is saying it's boring, just saying that he doesn't understand it. So it might not necessarily be a problem of the child. Most of the time, it's not the child problem. It is the person teaching, and not directly their fault, but either the methodology they are using. When it comes to, I mean, learning, there are different things you look at. So he's a 6-year-old, so I won't really talk about foundational issues. But even if I talk about foundational issues for a 6-year-old, I'm going to be talking about foundational issues of focus, concentration. So if he's a child that's been exposed to a lot of screen, he may struggle to focus, he may struggle to be able to attend. So that's why children like that, the first thing you are teaching them is not class. You're teaching them with play-based learning. So a 6-year-old really, to just sit down teaching a 6-year-old 1, 2, 3, ABC it's not the right method. I know most people do that, but it's not the right method. Play-based learning, they should be moving around. And we think that they are playing, they are not learning. No, play is the work of a child. Children learn through play. So telling a 6-year-old to be saying, pronouncing some ab, 1 times 1, it just doesn't make any sense. That's not the right methodology. So at that age, they should really be interacting with the environment and doing a lot of play, particularly the kinesthetic learner. If you're teaching those kind of learners, for example, alphabets now, or sorry, numbers, and you're teaching them 1, 2, 3, they will struggle, because kinesthetic learners need manipulatives. So for example, things like do I have those things? Linking cubes. You want to teach them counting. And you're teaching, because these days you see a lot of people they are teaching counting, and they're teaching counting by writing it on the board on paper. Instead of, when we're growing up, you have all these counting things that we normally use. I'm trying to look for manipulatives. I think I saw some public, or things like abacus. You're using your linking cubes. You're using even Legos, all those things to count, to do all those manipulative. So, these are linking cubes, for example. You don't have to buy this exact one. This is just an example. You can even use Legos or anything. So these are things. So imagine your son as a kinesthetic learner, you're teaching him counting or maths, and you're just saying 1, 2, 3, writing on the board. He can't really connect. It can't make sense to him. But if you bring out all these things, all these toys or Legos, and begin to count and begin to do all those things, he can make sense or use an abacus. You see? So that's talking about the methodology. So most of the time, usually you're not teaching the child the way they learn. So, and I always say that if a child doesn't learn the way you teach the way the child learns. So most of the time, we're using, number one, the wrong environment. So some children thrive better maybe in a smaller school, in a smaller environment. The learning style of the child, the teacher is not using that. Also, the methodology as well. Methodology of delivery of curriculum, the type of textbook. So some children do better with colorful things like that, while you're using method that is not the right method. Also, the child may also readiness as well. Sometimes at that age, some children do better with play-based learning or manipulative project-based learning, work with their hands and things like that. But sometimes we're trying to use just one methodology to teach everybody, and that may not be true. So what you should focus on is on the goal. So I want to teach a child something, whether I use flashcards, whether I use documentary, whether I use a book, a storybook or things like that to learn. Outcome is more important. So Because 6-year-old really, when he's talking about boring, yes, boring because he doesn't understand. So the methodology the teacher is using is the wrong methodology. Number two, maybe the class is too long. He needs break. He needs to break. That's why you talk about advocating for the child. He needs breaks. So most of the time, because at that age, you should not be sitting down for hours and just be cramming and or just writing and say the children are copying. All those things doesn't make any sense because it's just rote learning. It's not real learning that is taking place. Okay. So yeah, so I know that my son's school uses screen for 5-year-old. I'm worried this might be disrupting his progress because he's still developing speech and he comes home vocalizing a lot. Should I be worried? Yeah, you should be worried though. The parent talking about your child's school. So that's why there's something called what are the things you should actually look for before picking a school for your child. A good school may not be the right school for your child. See that, and that's why some of these things is what I see now. I see parents who have children who are 9-year-old. And by the time I'm talking, I drill down some of these are foundational issues. If a school is using screen, I don't know, because sometimes it's not everyone that is as would I say informed on some of these things. So that's why before you put your child in a school, what are the questions you need to ask? So as parents, you need to do, okay, you need to do your own due diligence. A good school may not be the right school. So you don't just tell me, oh, that's the only school in my environment. There are things you need to look out for. And they may not even know. They may not be as informed. People say children are learning. Let me say something. The conversation is not, oh, they are learning this from the screen. That's not the conversation. The conversation is, does the benefit outweigh the risk? And anything, all this when you say they're learning numbers and all that, anything a child can learn off the screen, they don't need to learn it on the screen because the damage of the screen outweighs whatever you're learning. And whatever you said he's saying, vocalizing, he's just cramming. You know, most of the time you say the child is singing all the song, the child is saying the alphabet. It's not real learning. Real learning means that what is vocalizing, he can explain that concept. He understands the concept. A child is singing a song. You should pause the child and say, wait, and all the things are in that song. Can the child understand it? Then whatever the child is getting from whatever he's saying, can he use it to interact with the environment outside of that scenario? If he can't, it's not real learning. All right. And that's why I say that for a 6-year-old, all this will 1 times 1, A, B, C, A for apple. I mean, I tell people that, okay, you and I are talking every day. Do you use that to interact? 1 times 1. Do you use 1 times 1? So the pressure of trying to get your 6-year-old or your 4-year-old to be reciting without teaching things like emotional regulation, focus, comprehension. You should teach things like that helps the child to think, to create. So that's when we say playing play is the work of a child. Kinds of play that encourages a child to build things, to create. But some of us parents, we don't like those things. Say the child is destroying things, he's tearing things, he's scattering. They need those things because it's in creating, in doing all those creative things, that building their thinking comprehension ability. Learning times table does not build any comprehension. It's just rote learning. And it is not a functional learning. It's not, you're not using it for anything. It's not a measure of intelligence. Measure of intelligence is that I can read my environment, I can interact with my environment, I can request my wants, I can read scenarios, I can read gestures, I can use language in a social pragmatic way, I understand social cues, and those are measures of intelligence. Not rote learning, where they just learn, they just cram it and just recite. That's called echolalia if you're not careful. If you just regurgitating, and he cannot make sense of what he's saying. He can't use that language that he's saying, that he's reciting in different contexts to interact with people or the environment. So you really should be worried. But I feel that at the end of the day, the foundation begins with you, the parent. You make the decision of the school. So the truth is that you need to know. Maybe you don't know. Maybe you're a person that you don't know. If you're in our community, maybe you just drop a message. I would help you with that on a resource that you can use to know the things you need to look out for in a school. So most of the time, parents are looking for the wrong matrix. You know, forget it's not all how aesthetics. It's all those buildings. Most of them are aesthetics. So there are things you need to look out for, and there are questions you need to ask. So if they don't meet those criteria, you don't have to put your child in that school. Then if you talk to them, some schools are open to learning and improving their system. but some schools are not. I would always say if the school is not open to that, then it's your choice. You don't have to put your child in that school. Like I said, a good school may not be the right school. They may not be a bad school, but you just have to be sure that it's the right school and aligns with what you're trying to. So I think you need to be worried. You need to be, in fact, be very worried. And yeah, you need to be very worried because I'm not sure. I don't even care if you say that you need to learn ABC, leave from. You don't need it. You don't all those things is unnecessary because the negative is way more. I would say a plus 5 minus 20 is it a plus or a minus. So those are always the conversation. So when people say, oh, they're learning, and that's what I'm saying. The plus and the negative. So if the negative outweighs the plus, then it's not a plus. Then also if you can learn those same things using other methods without exposing the child to those things, then you should do that. So thank you everyone. I think that I have yeah, so if you're in the community, Telegram community, please you can drop a message or you can send me a message and I will help you to, because I don't know where you are. And if you're in diaspora, I know it can be quite challenging because I know in diaspora sometimes we have limitation of schools because of the suburb and all that. But there are different ways to go about that because at the end of the day, you don't want to end up building and destroying and say, okay, because I don't have a choice. You have a choice, and there are different ways to navigate. You just need the right knowledge and guidance. That's all you need. Because at the end of the day, you don't want to look back and now have to start fixing problem that was avoidable in the first place. But like I said, you need to know what to ask. If you take your child away from that school now and you're going to another school, it's not just about screening alone. So do you know the questions to ask? Do you know what you should look for in a school for your child? If you don't know, you just need that knowledge. And thank you everyone. And I'll see you all tomorrow. And if you're in the community, please feel free to drop your feedback, your questions, and we'll be happy to help. Thank you everyone. I'll see you again tomorrow. Bye, everyone.
Like your child isn't talking like their peers, having behavioral challenges, not following instructions, or having learning difficulties. Or maybe you are currently navigating a diagnosis such as autism, speech delay, developmental delay, or even a learning disorder. You're trying to make sense of why your child struggles to attain skills that come so easily to others. Or do you find out that your child has been in therapy for several years, yet with little progress? This has left you with more questions than answers. At Autism Renewed, we see you and we are here to help. Hello, I'm Dr. Lola Okeowo, a medical professional and a global autism expert. I am the founder of Autism Renewed, an organization that works with parents and families all across the globe, equipping them to navigate developmental challenges.